Hi, I'm Dr. Corey Maas and welcome to the Maas Clinic. I think you're here today for some minimally invasive procedures, so let me take the opportunity to talk about some cosmetic injectable products that we have available that can improve a variety of conditions that may be of concern. The first group we've talked a little bit about is Botox, or the neuromodulators, Botox and Dysport, two products that have been around for a while now, both of which control the hyperfunctional or overactive muscles of our face, which give us angry scowls, deep crow's feet lines, the little radial lines around the mouth, and the bands in our neck. And they're very good treatments for using Dysport or Botox to really manage those nicely. The other broad category of injectables are cosmetic injectable fillers. And there are whole groups of these fillers. We've got a portfolio of them available now. And let me explain them in brief. The main filler that we use for cosmetic injections generally is a hyaluronic acid, which is not an acid at all. It's actually a long-chain sugar, which comes as a gel in a syringe for us to use. The products' names, which many people have heard, maybe many of you have probably heard, include Restylane and Perlane, Juvederm and Belotero. And there are some other ones out there that are not particularly prominent players in the area. And those four main products we use for a variety of indications in the face. But there are subtle differences. While they're all very similar and most of them contain lidocaine, the Juvederm, for example, has a lower G prime, has a little less stiff of a gel, and I like it in areas of transition like the commissure lines where it can spread out and have a little softer elevation of a depression or a transition in the face. In contrast, Radiesse or Restylane or Perlane have a higher stiffness factor, G prime, and when I say this, they're still very soft, but they do have a little bit more rigidity to them, so they hold their structure. So in areas like the nasolabial fold or the lip border, in many patients, Restylane or Perlane might be a better choice. They also have some differences in how much water they absorbed. Juvederm is on the high end of the water absorption. Again, this is a great way of softening transition in areas where there's only soft tissue, like around the marionette line. It can be used beautifully in the nasolabial fold for this reason, and holds holds a small amount of body water, again absorbed to the molecule for a period of time after the treatment. Restylane holds less water, and as a result, and Perlane, and as a result, I'll more commonly use this in the areas around the eyes where we don't need water retention. All of us know what it looks like to have sort of the watery bags after times of no sleep or little sleep. So there's specific indications that we use these for, and there are reasons why we might choose a different product for a different indication in the face. The last of the fillers that I mentioned, Belotero, is a newer one. It has a little bit different way of being cross-linked, and it doesn't have lidocaine in it. The unique thing about Belotero is that it's less visible when used close to the surface of the skin, which is an effect called Tyndall effect seen in some of these other products, in fact all these other products. So with fine line treatments like the radial lines around the mouth, sometimes the deeper smile lines on the face for people who don't want skin resurfacing or other options and just want a simple minimally invasive office treatment, Belotero for fine lines is a very good option. When I use Belotero for fine lines, I'm taking lidocaine, which is a numbing anesthetic solution, mixing it in with the product, and then we'll very carefully trace out each of these lines and can provide a very smooth effect, again, for radial lip lines and small lines around the face. So that's the HA fillers, and in general context, they're all very good, very reliable. We don't have to do skin testing any longer. And the real beauty of the HA fillers is that they're adjustable. If we have a bump or an irregularity, which is very uncommon, we can go back with a small enzyme injection called Vitrace or Widase and make that bump go away almost immediately. The other broad category of injectable fillers are the volumizing fillers. So if we think of the HA fillers as ones that are helping to improve transitions, depressions, or irregularities, or enhance lips, we think of the HA fillers. And then when we think of the other group, they're more volumizing fillers. These are fillers that in general are used in the malar area, submalar, and temporal region, as well as in some cases along the jawline. And these are stimulatory fillers. That's Radiesse is one of them, and Sculptra is the other product that are generally used as volumizing fillers. Tell you a little bit about Sculptra. Sculptra is a polylactic acid product, which is basically a milk sugar. It's delivered to our office as a powder in a vial, and we'll reconstitute that with water the day before the treatment. When the patient comes in, when you come in for your Sculptra treatment, we will have that ready to go, and it's a small series of injections in whatever area we're adding the volume or the enhancement that we're seeking, and usually it's 1 or 2 vials within an initial treatment of Sculptra. All the benefit, all the swelling, which is pretty modest with Sculptra, will go away in a few days, and it leaves the small particles behind which stimulate the body to make collagen around each of those particles. After a couple of months, we'll see the maximum benefit of that stimulatory collagen production, and we can do a retreatment. And over the course of somewhere between 3 and 5 treatments in most patients, we can achieve a natural, your own collagen-based volumizing effect. So the natural pathway or course of this is the patient, you will be treated, get swollen, all the swelling will go away, you'll get a little buildup. You'll come back for a retreatment, get a little swelling, all that'll go away, and a little more buildup. And over the course of a year, we'll get to an end result with Sculptra. The other product that's out there is Radiesse. Radiesse is tiny microscopic beads of calcium hydroxyl apatite, which is the same as our bone mineral. This is in a carrier gel, but I still use lidocaine and mix it and make it very, very dilute. And when we inject it, it's very much like the Sculptra injection. These tiny little particles, in contrast to Sculptra, don't go away right away, so you get an immediate volumizing effect when you do Radiesse, and yet the body is still stimulated to make collagen around each of these beads. So in contrast to the Sculptra, where it takes several treatments to get to the end point, Radiesse is usually 1 or 2 treatments to get to an end point that will last a year or longer. For both products, once a year or so to maintain that volumizing effect is the general timeline that we see for people getting facial volume enhancement. Both these products are safe. They've been used for many years. Unlike the HA fillers, however, they are not reversible, so we're very careful about it. And with Sculptra in particular, we're careful because in the studies that they did with trials, there was an incidence of small nodules that were visible and or palpable of about 16%. So great care is used with Sculptra to avoid the nodule effect that we talked about. That's an overview, a 40,000 foot view of what the fillers are like. I encourage you to ask questions. Certainly bring in magazine articles if you have them with you, or if you want to reference one, I'm happy to answer any of the questions that we have. You can certainly also visit my website where I've written a dozen or more papers specifically on this topic. And as always, I welcome any question from a patient. This is Dr. Maas on Looking Your Best.